This next topic on capillary fluid exchange discusses how fluid flows across from capillary networks into the interstitial fluid and back from the interstitial fluid into the capillary networks and back to the right side of the heart. This concept can be understood in this equation listed here. The net fluid flow is equal to a constant times the difference in hydrostatic pressure in the capillary system minus hydrostatic pressure in the interstitial system minus another constant times the oncotic pressure within the capillary system that's subtracted by the hydrostatic pressure in the interstitial system. We'll break this down a little bit further. The hydrostatic pressure is the difference in fluid pressure between the capillary lumen and the interstitium at this point here. The hydrostatic pressure pushes fluid outside of the capillary vascular space and into the interstitial fluid. It will always move from areas of high pressure to low pressure. In general, the hydrostatic pressure in the capillary system is greater than that in the interstitial system. So here we have the hydrostatic pressure of the capillary pushing fluid from the capillary network into the interstitium. Then we have the hydrostatic pressure of the interstitium pushing fluid back from the interstitial fluid into the capillary vascular space. As mentioned, hydrostatic pressure of the capillary is usually much larger than the hydrostatic pressure within the interstitium. The oncotic pressure is denoted by the pi symbol here, and we can see the oncotic pressure of the capillary network as well as the osmotic or oncotic pressure of the interstitial space. This pressure is different from the hydrostatic pressure in that it pulls fluid towards the particular space. So the oncotic pressure of the capillary pulls fluid from the interstitium into the capillary network. The oncotic pressure of the interstitium pulls fluid from the capillary network into the interstitium. So ultimately, it's these differences in Starling forces that determine fluid movement across the capillary membrane and enter the interstitium. There are two coefficients that are found in this equation. This one here, Kf, represents capillary permeability to fluid, so it's an intrinsic coefficient of the capillary permeability, while the sigma here represents or reflects the coefficient or the measure of capillary permeability of a protein. It's called the reflection coefficient that measures the capillary permeability to protein. So there are different pathologic conditions that result in alterations or perturbations of these specific Starling forces. So we can think about it when there's an increase in hydrostatic pressure in the capillary system, we see more fluid going into the interstitium. When we see an increase in our oncotic pressure within the capillary network, we see net fluid exchange or net fluid pulled from the interstitial fluid into the capillary network. Pathologic conditions in which we see an increase in capillary pressure, or hydrostatic pressure that is, something like right-sided or left-sided heart failure. In heart failure, we see blood ineffectively ejected from a failing heart, resulting in backload or fluid buildup in the venous system. As such, we have more fluid pedaling around in our capillaries, resulting in an increase in our hydrostatic pressure within the capillary network. As such, we see an increase in fluid being exchanged from the capillary space to the interstitial space, and this results in edema. Remember, edema is excess fluid flowing from the capillary vascular space and into the interstitium. So heart failure is an important cause of extravascular edema. There are certain situations in which there's a decrease in plasma proteins, which is reflected as a decrease in oncotic capillary pressure. Important syndromes that result in this include nephrotic syndrome, in which your kidneys are not retaining or they are inappropriately excreting protein. Liver failure, in which we're not producing important hepatic proteins such as albumin. So we see a decrease in proteins within the capillary space resulting in a decreased oncotic capillary pressure. And then also patients that are malnourished, who are not consuming the appropriate levels of protein, result in a decrease in oncotic pressure in the capillaries, resulting in more fluid being extruded from the capillary network and into the interstitial fluid space. Another situation in which we see increase in edema is when we have an increase in capillary permeability, or an increase in our Kf coefficient. So when we have an increase in our capillary permeability, then more proteins are going to be extruded into the interstitial fluid, resulting in an increased osmotic pressure in the interstitial fluid space and a decrease in osmotic pressure within the capillary space. Just as a note, I'm using the term osmotic and oncotic pressure interchangeably, and for learning purposes, ignore that, and they're both essentially the same thing in these discussions. So when we have an increase in capillary permeability, we see more protein being pushed from the capillary vascular space to the interstitial fluid space, resulting in an increase in edema. Pathologic states in which we see this occur, or an increase in capillary permeability, include toxin, infections, and burns. In these three scenarios, we see an increase in that capillary permeability and resulting in edema. And then finally, a situation that results in interstitial edema is when there's an increase in interstitial fluid colloid osmotic pressure. We see an increase in colloid osmotic pressure, and this is most often seen in situations where we have a lymphatic blockage, when we see lymph drainage being reduced by some means, whether it's the lymph node is congested or a lymph duct was cut in surgery or some other lymph blockage. This results in an increase in our interstitial fluid colloid osmotic pressure, resulting in a greater pull of fluid from the capillary vascular space into the interstitial fluid space, causing edema. Here's an image of significant lower extremity edema in the setting of elephantiasis. Here we can see significant extravascular edema that is very burdensome for the patient and is a result of infection in elephantiasis.